What supplements should I take? What are supplements? Available as tablets, capsules, gummies, sprays, or powders, dietary and nutritional supplements are used to complement a diet that may, potentially, be lacking. Why do people take supplements? Many people turn to a nutritional supplement to enhance or improve their health, but it's important to remember that a well-balanced diet remains the foundation for health and that no supplement can replace the nutritional benefits and advantages of enjoying a varied, well-balanced diet. That said, there are occasions when some of us may benefit from a supplement. Reasons for this are varied but may include a poor or restricted diet, increased needs such as during pregnancy, the use of certain medications, a compromised digestive system due to illness or age, and an inability to access the outdoors. Add to this the fact that many of the whole foods we eat, including fruit, vegetables, and grains, are less nutritious today than they were 70 years ago, and it's easy to see why some argue the case for supplementation. Which supplements are the most popular? Popular choices include vitamins B12, C, D, and folic acid, minerals such as iron, magnesium, and calcium, as well as fish oils and probiotics. Most of us should achieve all our nutritional needs from a healthy, varied, and balanced diet, but there may be some circumstances when a supplement may be helpful. Vitamin B12. Why might I be low? If you have a compromised digestion due to conditions like celiac or Crohn's disease, or you are elderly. If you follow a plant-based or vegan diet. Where can I get B12? Food sources include meat, liver, milk, eggs, fortified breakfast cereals, fortified plant milks, fortified nutritional yeast flakes. Supplements, such as Boost B12 oral spray. Folic acid. Why might I be low? If you're a woman planning a pregnancy or in your first trimester. If you take certain prescribed medication, including those for epilepsy or a diuretic. If you have a compromised digestion due to conditions like Crohn's or celiac disease. If you are elderly. If you consume high levels of alcohol. Where can I get folic acid? Food sources include dark green leafy vegetables, beans, peanuts, whole grains, liver, sunflower, and pumpkin seeds. Supplements, such as active folic. Vitamin C. Why might I be low? If you consume high amounts of alcohol, are a smoker, have a poor diet or an eating disorder. Have type 1 diabetes. Have an inflammatory bowel disorder. Where can I get vitamin C? Food sources include citrus fruit, peppers, strawberries, tomatoes, and white potatoes. Supplements, such as vitamin C capsules. Vitamin D. Why might I be low? 1 in 5 of us are thought to be low during the winter and early spring months. If you have dark skin, cover up for cultural reasons, or are housebound, you may be at increased risk. Where can I get vitamin D? Food sources include fatty fish such as salmon, trout, and sardines, eggs, liver, fortified plant milks, and spread supplements, such as D1000 vegan vitamin D oral spray. Iron. Why might I be low? If you are menstruating or pregnant, if you have conditions such as irritable bowel disease, IBD, or celiac disease, if you follow a poor or restricted diet. Where can I get iron? Food sources include red meat, darker poultry meat such as thighs, liver, lentils, beans such as kidney beans and chickpeas, nuts, dried fruit, fortified breakfast cereals. Supplements, such as Spatone. Magnesium. Why might I be low? If you have conditions such as Crohn's or celiac disease. If you have poorly managed type 2 diabetes or a kidney disorder. If you are on prescribed medication including diuretics or antacids. If you follow a restricted diet, low in vegetables and nuts. If you are under extreme stress. If you have a high intake of alcohol. Where can I get magnesium? Food sources include whole grains, dark green leafy vegetables, nuts, and seeds including almonds and sesame seeds. Supplements, such as marine magnesium. Calcium. Why might I be low? If you have a diagnosed milk allergy or lactose intolerance. Are postmenopausal. Are female and of reproductive age but not menstruating. Are a high-performing female athlete. Have a restricted diet and are adolescent or elderly. If you follow a plant-based diet. Where can I get calcium? Food sources include dairy foods, fortified plant-based milk alternatives, tinned fish with bones, green leafy vegetables, dried fruit such as dates, tempeh. Supplements, such as seaweed calcium. Omega-3 fatty acids. Why might I be low? If you have a diagnosed fish allergy. Are following a restricted diet, including a vegan diet. Have a greater need such as during pregnancy or breastfeeding. Where can I get omega-3 fatty acids? Food sources include salmon, mackerel, trout and sardines, nuts and seeds including walnuts, flaxseed and chia seeds. Supplements, such as omega-3 vegan algae. Probiotics and prebiotics. Why might I be low? Those with antibiotic-related diarrhea. If you have irritable bowel syndrome, IBS, or vaginal dysbiosis. Where can I get probiotics and prebiotics? Food sources of probiotics include bio yogurt, kefir, sauerkraut, kimchi, kombucha and miso. Food sources of prebiotics include asparagus, banana, garlic and onions, Jerusalem artichokes. Supplements, such as Optibac every day. Should I take a multivitamin? Many people wonder if they should take a multivitamin on a just-in-case basis. As the name suggests, a multivitamin is a supplement that contains a range of different vitamins and minerals, and sometimes other ingredients, such as herbs. Exact formulations will vary depending on the brand and product you choose. It's important to remember that taking a multivitamin will not compensate for poor eating habits, and supplementing with high doses of nutrients may be inappropriate and even harmful in some circumstances. Improving your diet with plenty of nutrient-dense, whole foods is more likely to be an effective approach for your long-term health and well-being. That said, those who may benefit may include the older age groups for whom a combination of factors such as poor digestion, a low appetite and an inability to get outdoors may leave them lacking in some nutrients such as vitamins B12 and D, as well as the mineral calcium. For those on a restrictive diet, and this may include vegans and some vegetarians, a multivitamin may be helpful because it may support your intake of the harder-to-get nutrients, including vitamins B12, D and minerals like iodine. That said, for most of us there is inconsistent evidence to support the value of taking a multivitamin, and for those diagnosed with a specific nutrient deficiency it may, depending on your circumstances, be more effective to supplement with just the nutrient you are lacking. Speak to your GP for guidance. I am pregnant, should I supplement my diet? Yes, during pregnancy your need for certain nutrients increases and you'll need to supplement these. One important vitamin at conception and during pregnancy is folic acid. This vitamin helps to prevent your baby from developing neural tube defects, such as spina bifida. For this reason, moms-to-be are advised to supplement with 400 micrograms of folic acid daily from when she plans for a baby until week 12 of her pregnancy. If you have diabetes, sickle cell anemia or take medication for epilepsy, your folic acid needs may be greater still and you should seek further guidance from your GP or registered dietitian. Another important nutrient during this life stage is vitamin D, which vitamin helps your baby's bones and teeth grow and keeps yours strong and healthy, too. You should take a supplement with 10 micrograms of vitamin D daily, throughout your pregnancy.